Good morning, everyone. We will get started. So welcome to HDR UK Scotland's session on the HDR UK Cohort Discovery Tool. We've got Carole Morris with us, who is Head of Data and Modelling Service at PHS. And she's going to give us an introduction to Public Health Scotland. And then that'll be followed by James Watson, who's the Principal Information Development Manager at PHS, that'll take us through the Cohort Discovery Tool. And then there'll be a section where you can ask questions. We are recording, so just so that you're aware, but I'm going to hand over to Carole to give us an introduction to Public Health Scotland.
Hi, Katie. Thank you very much for that. Rachel, are you sharing the slides, or are you wanting us to do it directly?
I'm happy to, that's fine.
Just in case there's any technical issues, usually keep it all in the one place.
Can you see that?
Yes, I can. Thank you very much. Grand. So just click on to the next slides. Yeah, so I've just asked to give a very quick introduction to Public Health Scotland and who we are and what we do. So just a little bit of background. We were formed in April 2020, which is exactly what you want to do, start a public health agency at the start of a global pandemic. So needless to say, the focus was a little bit preoccupied in the starting 3 years of the organisation. We had a baptism of fire. That certainly is the case, and we're now just I would say firmly kind of stamping our feet in the sand as to what exactly Public Health Scotland is and what our direction of travel is. So we are accountable to both Scottish Government and local government, so joint sponsors with Scottish Government and COSLA. And our mission is to address the public health challenges of the country. So I'm sure I'm probably sort of preaching to the converted here in the fact that Scotland does suffer from some of the poorest health in the Western world, and some of the challenges that we are facing are around mental health, inequalities, drug-related deaths. We also, in addition to that, manage, as we did through the COVID-19, health protection incidents, incident management control, and we're also looking at other areas such as climate change, which are threatening health across the globe. So kind of a lot of diversity in what Public Health Scotland covers. Move on to the next slide. And this is just to give you a bit of an idea of that kind of breadth of stuff. So at the moment, we're heading into the vaccination programme, the winter flu. On the back of that, we look at things like system pressures and bed capacities, working with the health board. As I've already said, kind of health protection, MPOX is quite high profile at the moment. But also what we do as an organisation is look towards that long-term prevention as well. So what work can we do now that will make a difference in the future? So never a dull moment. Every day it can be different, but it's all exceedingly important work in respect of what we do. Next slide. So yes, our mission in life as an organisation is to prevent disease, prolong healthy life, and to promote health. So build those foundations for the future, which I think is very important to everyone. So next slide. And just kind of a nice segue into what James is going to talk about is just to give you an idea of some of the data sets that Public Health Scotland has at a national level, which of course is very much supported by a lot of the local data held within the regional safe havens and the local sites as well. So we have everything from kind of pre-birth records, maternity obstetric, through the childhood surveillance, immunisation, through to your hospitalisations, your prescribing information, both primary and community, and now at hospital as well. Registries, renal registry, diabetes registry. We are working on getting a national primary care data platform in place, and we're doing that work with National Services Scotland and a number of other people, the GPs obviously as well, to make that happen. Through cancer registry, cancer treatment, medical imaging data, right up into the death registration. So we have a mountain of information that we can turn into intelligence to support work looking at the public health priorities. And that is kind of a nice segue into the HDR UK Cohort Discovery Tool, which is going to provide some capability of researchers to have a look and see what research questions may be feasible at that early stage when an idea comes to mind. So now I'm going to hand over to my colleague, James Watson, who's going to talk you through the tool. So thank you very much.
Hi there. So yes, so I'm here to talk about cohort discovery. It will be referred to on the gateway as cohort discovery, or at best it's an application, but yeah, cohort discovery tool is an old term for it. So I'm a research coordinator at Idris, and I help basically projects get through permissions panels, but then in other projects like these kind of cross UK ones that kind of help deliver some parts of the projects that go through the team as well. So just going to very quickly kind of give an outline of what is cohort discovery, why we need it, how do we make this data comparable across nations, and I actually just go into a live demo so you can see how it's running. So if we can go to the next slide, please. So cohort discovery is a project that really originated in the midst of the pandemic, and it came from a project called CoConnect, which was a COVID-curated and open analysis and research platform. And basically the program was set up to allow rapid identification of COVID-19 data. And that technical project specifically set up for COVID was demonstrated to be incredibly useful during the pandemic to identify cohorts for research projects across the UK, looking at specific groups of people to do work on. So now that we are kind of thinking beyond the COVID pandemic, we're trying to expand the data sets covered and the types of data that you can search for, because cohort discovery is part of every project that comes through our doors, to be honest. Can you go to the next slide, please? So the main kind of reasons why we need this application, I suppose, or why we need cohort discovery, is that it just allows you this rapid feasibility assessment for your project, because obviously you need to know you've got a statistically significant population to actually run any studies on, or it just saves a lot of researchers' time, data custodians' time, because then we don't get inquiries saying, oh, I want to do this project and we want to figure out this subpopulation, how many people are in Scotland, and then we have to run queries and say, well, you might not get enough, or there's only a few hundred in the country, you might have to be quite targeted in that. So it's primarily about making it easier for researchers to identify where they might be able to find the information they're looking for. And it's also a bit of a kind of first step, for at least for us, towards kind of more federated analysis type approaches, because in order to get the platform to work, there has to be a kind of standardization of terms across the different systems. So if you can go on to the next slide, please. That comes onto how we make it comparable. So the approach used has been OMOP, and you may have probably heard OMOP being discussed a lot of times. And it's basically a common data model that describes how data can be stored, categorized. It's not strictly speaking an ontology in its own terms, but it allows different health systems to, at least if you're talking about heart attack in one system, you're talking about the same thing in another one. So you map all these different terms at different levels to the data. And it should allow for the same query to be run across different areas and to give you, so you're asking the same question. And the software that's being used to map the terms to the model is called White Rabbit. But there is an element of manual mapping, especially when codes are invalid, and that reflects differences across the UK and how terms are used. Even standard ontologies are not always mapped exactly the same in different areas. And so all the software to do all this is installed in the National Safe Haven, and it allows us to run external queries, and what it will do is it will return a total count as a result. If you go to the next slide, please. So this work is basically a kind of collaboration across multiple partners. Obviously, HDR UK kind of provided the initial kind of funding. They've got the platform that everything's going to be run on, and they're involved in the project management. Public Health Scotland, we are obviously providing access to our data sets, but we are also being involved in getting the governance for this project to go through and get the permissions to allow this to happen. And we're also being involved in the disclosure checks of the data going out to set up the that's transformed and sent to the that's used in the searches, because we have to make sure that it's safe and there's that privacy isn't breached in any way, shape, or form. And I'll come to that in a minute, and you can see it in action in the tool. Obviously, EPCC provide the technical infrastructure for the National Safe Haven, and they also provide a lot of local support to the software and getting all of that installed and up and running. And also University of Dundee have been absolutely crucial in providing us the technical skills for the mapping and the assistance with the OMOP software itself and getting changes made to it, because as we discovered with setting up some of these large data sets, the tools needed some minor tweaks to operate well. So we've kind of impacted on how that works as well. So if you could go to the next slide, please. So coming back to the data security, the Cohort Discovery follows the 5 safes framework, which I'm sure you'll all either have heard of or be fully aware of. And basically, safe people, safe projects, safe settings, safe data, and safe outputs. And this kind of tool meets all of these different criteria. So safe people is you have to have an account with HDR UK on the gateway, and then you have to register to use the tool. Then the safe projects, they monitor the kind of queries that kind of go through. The safe settings, everything is in the data is held in the safe haven, but it's also completely isolated from the data that's then transformed. And it's also doubly pseudonymized, so that even if you did manage to get the data in some way, shape, or form, you could never go back to the identifier of an individual. And the data itself is transformed, and only the transformed data is kept in a particular area of the safe haven. Plus, the query tool doesn't actually directly access the data. It sends a query to the to a bit of software in the safe haven. The software in the safe haven runs the query, returns the results, and transmits back just the numbers. So it's quite a safe system for sending the information. Plus, we also round the results, and we also do not return any counts that are less than 10 for statistical disclosure reasons, so that no individuals can be identified. And it also prevents people from differencing searches in order to identify very low numbers of people. And if there is incredibly rare terms in the actual data set that where there's fewer than 10 people that have that term, the terms won't even be mapped. So the system doesn't know about them from that data set. Okay, so if we could go to the next slide, it's demonstration time. So I shall share my screen, if that's all right. Let me just go to this. Okay, so that should be the slide at the minute. And if we go to Gateway, Gateway. Yes. Excellent. So this is the newly enhanced HDR UK Gateway. And I've already logged in, but if you were coming to this fresh, you would have to either sign up, or you can see a lot of the information that's on there that's publicly available without having to sign in, but you cannot access the Cohort Discovery Tool without signing up to an account and then registering to use the tool itself. So I've obviously signed in as me, and I've got access to the tool. So I keep calling it a tool, to Cohort Discovery. And I shall go there. And it'll give you a bit more detail about it, a little video of the origins, bits of information about what the tool's about, what Cohort Discovery is about, and I'm just going to access it and demonstrate how it actually works. So, when you first log in, this screen would probably be empty because this is a list of all the previous queries I've run. So obviously, as I test things and the previous queries are kept, you could delete these if they're not needed, but it does let you run lots of queries and then kind of go back to them again at a later date, which is quite nice. One thing I should point out is there is a very nice option here for those of you who prefer dark screen work to flip to dark mode rather than light mode. So that's quite a handy little piece. So in order to do any search, you have to do this add new cohort, which is basically just you're creating a new search. And when you do that, you just get your blank screen, and the collections are the list of data sets that are available to you. So you can see there's a pile of data sets already. And the two Public Health Scotland ones we've got in play at the minute are the NRS deaths records and the Public Health Scotland mental health inpatient and day case, so SMR04. The information on the right will give you some general information about the data set. The main contact's me for these at the minute, but that will be changed to the Idris mailbox at some point in the future. And it gives a link to the data sets, some overall information about the general demographics, the age ranges, things like this, min-max, number of counts of male, female, etc. And a list of OMOP variables that are in there. So if, for example, I want to, let's just do a simple search against NRS deaths. So I think this system was designed originally because of COVID looking for genes, but as such, we're not looking for genes. So the best way to add a condition is to add a filter, basically. So what we're trying to do is build up a query. So let's say cardiac arrest. So as you start typing words, it will look through all the OMOP terms. And you can see under the condition, there's a number of terms here that are deemed to be cardiac. And the boxes on the right here will tell you which data sets that term was found in. So you can see the SMR04 and NRS deaths contain sudden cardiac death records in them. So that term is mentioned. Same with cardiac arrhythmia. Cardiac arrest is in a bunch of other services as well. So if I just pick cardiac arrest, you can add age modifiers in here. So let's say I was interested in very young cardiac arrest. So let's say people under the age of 30. So you've got age less than or equal 30 years. And then if you add that to the group and then close this, you can see it's added in. We want everything that's cardiac arrest, age less than 30 years. So if that's all you're interested in, you could just run a query on that. And I did do less than 20, so there we go. So it's saying that there's about 190 records in NRS deaths where the person is less than 30 years old who died of cardiac arrest. And if you want to find out more about the data set, there's a link here, and that takes you back to the gateway where the description of the data set is found. There we go. So this gives you the general overview of all the information. And one of the things to point out about NRS deaths data is that NRS deaths data is provisional for the previous year, and it's only finalized in August of each year. So, and that's also in the coverage and completeness information, which takes you to the PHS IDRIS webpage where we give updates on information. There's the full description of which terms are deemed to be provisional. So it's a nice way out of the cohort discovery into the data sets, and you can explore more about them and find links to other media, look at the different variables. And once you're in the gateway, you can then request, you can start building inquiries or applications through the gateway as well, if you're doing national data sets. So anyway, that is kind of simple cardiac arrest one. Let's see, and that's for underfoot. So if I actually delete that term and just do the same one again, cardiac arrest, but this time not leaving a modifier, and then run the test again. You can see that there's 6,710 results. Okay. Now, if I add in another filter, and this time make it perhaps just interested in females, this the default is to set it to or matching, but if I want females and cardiac arrest, I would have to change it to and then that gives you 2,720. So it lets you build up lots of queries. You can save these. Whenever you create a query, you can then name it and save it. So let's see, female cardiac arrest, and then you can save that query. And if I go to if I close that, it will appear in my history list. It should appear here. Okay. Yeah. Anyway, you can save and you can rename the queries so that you can go back to them with more memorable descriptions of them. And let me just demonstrate something to do with the rounding. So, yes, this is a good one. So let's look at SMR04. And we are going to look for a term called alcoholic I'm looking for alcoholic gastritis. So alcoholic gastritis is a term that's found in SMR04, and it's also found in NRS deaths. So if I select that condition and then run that term, you'll get 20 results. That's quite a low number, and that's all males, all females. If I add in, for example, females, and run it again, okay, you get no results. If I take that out, okay, so it's like, okay, maybe they're all males then. Add filter, add the males. Run it again. And if I'm right, this should result with nothing. Oh, that results in 20. Now, in this case, you might think that's all the men, it's all just men. But actually, when you look at the underlying data, it's to do with rounding. There are a few females in there, but there are less than 10 of them. And it means that when we do the round, when you do a search and it returns less than 10, it gives a 0. But if, because of the rounding, there's less than 20 but greater than 10 in total, male and female. So it just gives there's a bit of subtlety to this, and that helps protect the identity of individuals as well. So that kind of shows some of the rounding issues, and it's not issues, it's specifically designed so that you can't identify individuals or very low counts by just combining terms. So that's kind of key bits and pieces. I don't know if we want to, that's kind of main features of the tool, and it could try lots of different searches that show big numbers, small numbers, and combinations of terms. But you can also see, if I add in the collections and take out male, and I call it gastritis. When you run it on multiple collections, so multiple data sets, basically, it should, yeah, gives you numbers. So it says that there's 50 in NRS deaths in total, but in SMR04 there's only 20. So if you're looking at different data sets across all of the UK or different parts, you can figure out, okay, there's 20 in that part of the country, there's 50 in this card, and then you can say, okay, across the whole nation we've probably got enough people. So that's why it's useful for cohort discovery. Okay, so if I go back to the presentation and skip past the sections, 1 second. Oops, sorry. Let me just skip through, because basically I'd created this in case there was a technical issue and they couldn't show it. So I'm just going to skip past all of this because it just shows you the same thing. Oh, yes. So people don't like change, but make things fast enough. You go from one type of normal to another. So it's just going to say, does anyone have any questions, or do you want to run any live queries? I don't mind.
Thank you very much,
So
James.
if I stop sharing my screen.
Yeah, there's a few questions in the chat for you. So the first one, well, there's a couple of questions that are around the same. So one of the questions was, are the results for the previous 1 year or from the formation of the data set?
It's all records from, let me just see. NRS deaths is 1981 to 2020, well, 2024 technically.
Okay. So could people filter
yeah, so
on
it's the kind of the lifespan of
the lifespan of the data set? So that brings us on to the next question from Lynn then. Can you filter on specific years?
I think you should be able to filter on years. At the moment, the filter, when it comes up, you can filter on age, but there's a filter on time, and it's in months. So I think the plan is you should be able to filter on years because they know the data set is structured in such a way that you have the year of the event, but I don't know how to do it directly on the tool at the minute, but it should be possible to filter by years.
Okay. So another couple of similar questions from Helen and Archie. So this is there an order of precedence for the and or operations?
What do we order? Oh, I don't know actually. That is a good question. I don't know, but I will actually go and try and find out.
Okay.
Order
And then following on from that, Archie was asking, can you like query A and B or C and D?
You should be able to.
We could maybe try that. Can we try that with a live example?
Let's see if we can try it. Find something big, something that's going to give big examples. All right, let's share my screen again. Okay, let's do a new query.
Are you sharing your screen?
Oh, sorry. There we go. Right, let's just do a query on deaths. I never did very complicated queries when I was checking it. Should have done. Let's add a new filter and search for let's do cardiac arrest. And to drop. And let's do cardiac arrest and male. Oh, that's a bigger number. Actually, let's just run that so I've got a number to test for, because the problem is you can't build up tests, run, and then add another term because it removed the previous number. So it says 4,000 there for cardiac arrest plus male. Okay, and then add what should we do? Anyone got any suggestions of what to do instead of cardiac arrest and male, or maybe a term that's specific for female? I do have to have a list of ones.
Amy suggests drugs, but could you do drug tests?
Let's see both. See.
Although I guess if you want to submit female, you could do ovarian cancer, deaths from ovarian cancer. Would that come up?
Yeah. Cancer. Right, let's see. Actually, I've got another one here. Or
stroke in female was another suggestion.
I know one.
Okay.
That gives a rare number, so I know exactly how many should be added. This is a very odd one. Here we go. Acquired coroner. I'm going to search for it using the actual. So that's the thing. You can actually search for terms with the actual OMOP term. So if you've looked through the list of things, or you've run a search, it'll tell you what the. So if I click on the thing, it tells you what the OMOP code is. So you can actually search for that code if you don't know that. So in this case, or you can search for particular OMOP SNOMED terms. So acquired coronary artery fistula and female. Let's see what this does. So that should, in theory, be 4030, I think, or.
I think, do we need a
No.
or between group 2 and group 3?
Oh, yes. Sorry.
Oh, ooh.
Oh, it changes them all.
Okay.
Individual results in group 3 are combined with AND operator. That's very good. Thank you
Question
for
we can
testing
put to
that.
the HDR UK team.
Yes, because I think there must be some kind of way of doing it. It's just I don't know what the particular combination of terms, or perhaps you can save terms searches separately and then combine.
Okay. All right, well, thank you for that. Archie, we will answer
Sorry.
that for you at a later date. So there's a few more questions. So one of the other questions was, is it possible to get a UK map of a condition by NHS board or by some other geographic description?
I don't think we've got the board mapping on this. I think it will just give you the I don't think we put geography into it because of the risk of disclosure.
Okay.
Especially in smaller kind of islands and stuff, it would be really easy to identify people.
Okay. And then another question, and I had a similar question as well. So this has come from Bernard. If when you got some of those zeros, do you get notified if it's a true zero or a rounded down zero?
No, it's just a zero. But the thing is, if you were trying to do a study and you were only identifying 10 people, is it really worth doing that study?
Okay. Yeah.
Like if we were doing a project and we were trying to get that out, we'd never be able to pass any of the SDC checks for any of the outputs anyway. So it's a kind of a tricky one to.
Okay. And then one of the questions I had, when you showed the last example that you did before we tested the ands and ors, you had like that relative, and it told you that there were so many in one data set and so many in a second, and gave you a percentage. Does that tell you how many are included in both, or does it assume that they're both distinct?
That's what we're trying to work on at the moment. I think they're distinct, if I remember rightly.
Okay.
But I think that there's some discussion going on, Carole, isn't there, about making it so we can do a search that would identify the exact overlap of each of these.
Yeah, we're in discussion. This is our first iteration of getting the data on the tool and use of it. So we ourselves are still getting used to it as well. But it's it's good to get these questions because we can have that conversation with the HDR UK technical team about next phases.
Okay, well, following on, Archie's got one of those questions for you. So that was, if the tool builds an SQL query, could you have an advanced option that would allow a user to edit that script? You might not be able to answer it, James, but it's maybe one to take away with you.
No, I'm not sure, but I don't think you can. I don't think the communication between the gateway and the tool that's in the safe haven, I don't think you can edit those queries because they're supposed to be isolated so that people can't do kind of bulk queries and do really sophisticated stuff to harvest data. It's kind of kept separate from each other. But we can find out if there is ways of editing these.
Yeah. I think, Carole, you've already answered Keith's question, haven't you, in the chat? But just so that everyone can hear that there are some plans to expand the number of included data sets, and I think you're working on inpatients and outpatients, and then we would follow up with maternity and cancer registry.
Yeah. For anyone who's been involved in OMOP before, it takes quite a bit of time and resource to do the terminology matching.
Okay. Does anyone have any other questions for James or Carole?
I think probably just a final thing to say is that Dundee University have been fantastic in supporting us in terms of the OMOP mapping terms, which it's been really good for us and given us a major insight into OMOP itself too, which has been fantastic, along with the HDR UK technical team.
That's great. Yeah, so well done, Dundee, for helping with that. There's a couple of questions just about how they would access the tool. I know they joined a bit later. So James, you showed at the start that they'd click on Cohort Discovery. At the moment, for some of us, it says that our access is a waiting access. So is this a live tool that people can access now?
Yes, so the data set, I think people can register for it. Carole, I'm not 100% sure where we were with the live because we were waiting on the gateway because the gateways underwent a lot of changes recently and we were waiting for that to be completed before the cohort discovery was launched formally. But as far as I'm aware, those two data sets should be going live now.
Yes, that's okay. What I was about to say. Oh, and Charlotte, she can tell.
I'm here. Yeah. Sorry. So yes, there are a number of requests pending approval at the minute. We had a bug in the welcome email, so we found that out, unfortunately, after we'd gone live. So I'd approved a couple of requests and then realized that this bug needs fixing. So we're just waiting for that to be deployed to production, and then the requests that are pending approval will be pushed through, and you should receive your welcome email and be able to move forward and access the tool. So one thing that's important to note, it's when you first register on the gateway, it does highlight that you can sign in with Gmail or institutional ID. For Cohort Discovery, if you would like access, you must use an institutional email address when you're registering. So that's also something that we need to make sure it's clearer. It's not clear at the moment, so that's something we're working on as well.
Okay.
So yes, your approval should be going through shortly, and then you'll be able to have a look around. And yeah,
that's great.
Obviously, there are a lot more data sets available for people to look at besides the PHS one. So gives you a wider sort of overview of what's available, and get graphs, sort of the age distribution graphs, male, female as well. So that's also quite interesting.
That's great. Thanks very much, Charlotte. Carole, I've got another question for probably you or James, which is, what's the difference between using this tool versus going to Idris or the local safe havens?
Good question. So this is to give people a kind of almost like an intro. As it grows and we add more data sets, if more and more people are going to the HDR gateway and they can see what data sets are available, they can then register and maybe do that kind of early feasibility. Then they might, off the back of that, go, oh, actually, my idea is feasible. And then they'll come into the National Safe Haven in Scotland and the IDRIS team and have that conversation in a bit more detail about where we want to go next. Can also come directly if there isn't, if it's something that isn't available in the tool at the moment, or you're looking for additional information, can come straight in. The two options are available, basically, to cut a long story short.
But I guess this is a tool that people can go play about with and get a feel for what's there.
Exactly. Yeah.
Okay. Which brings us on to another question. Is there a lag for data collection? So like if we're using this tool, how often will it be updated? Or is it connecting directly to?
It's not connecting directly. It is data that is being basically transformed and moved into the environment that allows it connect to the gateway. So that is conversations that we do need to have going forward, as kind of update frequency, etc.
Okay.
Yeah.
Okay. So I think, yeah, for that question, so there is a lag and it'll be confirmed. Perfect. Okay, great. We've got a couple of minutes. If anyone's got any final questions. Whilst you're thinking of your final question, I will do a plug for our next session, which is with Research Data Scotland, which is on Wednesday, the 4th of December between 1 and 2. And Research Data Scotland will be here to present around their Researcher Access Service. And Serena very kindly shared the link earlier on that you can register if you're interested in that. I don't see any more questions coming in. So I will just take the time to thank both Carole, James and Charlotte for presenting today, answering the questions and demonstrating the Cohort Discovery tool, and to Serena and Rachel for organising, but most of all to all of you for attending. Just a reminder that we will send the recording and the slides out after the event. But thank you very much, everyone, and we will see you all soon.
Thank you.
Thank you.
Thanks, everyone, and thanks for the great